I try very hard to show up for them because I know this is not easy.
One patient in particular I can think of, he was really sick.
Holding their hand, we're consoling them.
We would hold the iPad for family members so they could be with their loved ones while they passed away.
It was just over and over and over, and yet they came back in shift after shift after shift.
What keeps me going is definitely helping those that are vulnerable, those that are in need.
Sometimes it doesn't go the way that we want it to go, but a lot of times it does.
But I can't lie. I mean, I definitely was scared. I mean, I think everybody was.
If you don't see it on their faces, listen to their words.
We've been open through the pandemic for a reason. We're the soul that keeps the fight going.
Exhausted, beat down, bruised, yet they won't stop fighting.
Every day that I come into work, it's just focused on the job that we have to do.
At St. Joseph Hospital in Denver, Gabriel, Hannah, Paula, Jesus, Steph, Dan, and Greg are all on the front line.
Probably the biggest high is seeing a patient get discharged after having COVID.
Okay, but it would be nutritional services.
Paula Stout
It's not the dietitian.
is sure of one thing.
It was hard. It was hard to get a position as a new grad nurse in a pandemic.
She couldn't sit out this fight.
Everywhere I applied, everyone was like, hold on, we just don't know what this will be. We want nurses to have experience. And I was like, I have no experience, but I want to help.
She needed to help.
I came into the United States as an immigrant. I was a DACA student for many years. I grew up without much access to healthcare, so I wanted to, just do something different and do something for my community.
I want them to feel empathy. I want them to feel welcome.
You try to be compassionate. You try to listen well.
For me, sometimes I need to take a step back and just check in with myself.
Days and weeks turn into a seemingly endless war against a virus, and it's taking its toll.
But I'll just always remember, I think, just the look in the eyes of the staff that have had the biggest bulk of the load for COVID. That's the one thing that I think I'll always remember. So you doing okay yourself?
Greg Slate knows emotions can speak louder than words.
Next week I've got 2 resiliency check-ins with new grad nurses.
His focus as a hospital chaplain has shifted to supporting healthcare workers.
When you're dealing with a lot of death, consistently over an extended period of time, that's incredibly challenging to know how to cope with.
We just work so hard to keep our patients alive.
For me personally, I'm African American, I'm half Puerto Rican. These populations have been disproportionately affected by the pandemic.
Dr. Gabriel Lockhart knows that. He's the medical director of St. Joe's ICU.
I held a 2-hour lecture so I could talk to my family about where the vaccine came from and why it was so important for that population especially to be vaccinated. My mother, she's Hispanic, and she for a long time was not going to accept the vaccine. And she later on came to me and said, you were right, and it was foolish of me to not get vaccinated, and she's been super thankful for that.
Hi there, welcome.
So at this point, you're going to open your tubing here.
We'll help you right over here, okay? Miss Christine will take care of you.
Most patients recover. Few stay in touch.
There's not as many happy moments as sad moments.
Happy moments for Dan Rakowski.
One patient in particular I can think of just came in with COVID and it really kicked his butt. You hope he gets better, but you never know.
His patient recovered and reconnected.
First time I saw him, we just embraced in a big hug. He's got a big smile on his face. It was a really nice moment to just see someone doing so well.
Holding on to these moments.
That's what keeps me going. It keeps me going knowing that they're getting better.
Just trying to comfort them in some way.
I felt the need to help.
It's very busy. The majority of what we're seeing are unvaccinated patients.
Inside a nearly full intensive care unit, every day is a fight.
You do sometimes feel like that the medical profession isn't quite as valued as what it used to be. However, you can only keep trying.
The hours, fatigue, the stress, and fear.
The last shift I worked, I got 21,000 steps. It's 9 miles.
Nurses like Hannah Wayne.
I don't want to cry.
And Steph Musgrove put it all behind them.
I'll be completely honest, throughout the pandemic, especially when people went from calling us heroes to then now liars, you can't help but think why do I do this still? you're trying to save somebody who has COVID and they still sit there and tell you that they don't have it and they don't believe you. And this is not COVID, it must be something else.
In the pandemic in the beginning, when we didn't allow any families, often as nurses, we were the last person that the patient talked to before they went on the ventilator. And it was really difficult if that patient didn't make it, because it was almost like we were their family, we were their support system. It is a lot of responsibility, but it's a really sacred responsibility. It's like a really, I think, rewarding responsibility, because it's not often in life that you get to have that personal connection with a total stranger.
It really, really fills my heart to help people who are less fortunate.
I look at what I can do to help them today.
I've personally started going to therapy because that's something that I desperately need.
These are the faces on the front line.
Seeing the resilience of the people who are still there makes me want to stay as well.
Exhausted, yet still here.
It's not easy. It's not easy at all, but I do it anyways.
Through all the challenges, one of the things that every person that we spoke to there talked about was the support that they've seen from the community. There were days through the pandemic, especially at the beginning, when the break rooms were filled with food donated from the community to help feed healthcare workers for breakfast, lunch, and dinner. But if you think about things like the 8 p.m. howl guys that we used to all do, everybody coming out and clapping for the healthcare workers, those efforts of support have kind of come and gone, which they've noticed.
So now they're at this exhaustion point. They're trying to save the lives of people who are calling them liars. I mean, what keeps them in that game? I mean, as we know now in this economy, there's lots of things you can do if you don't like your job.
Exactly. People have quit. There are people who have left who have said, we can't do this anymore. But those who have stayed, one thing that brings them all together and keeps them going is saving patients. The other is that they're there to support each other. They can't get out of this fight and leave their colleagues still there. They're all in this together, and they realize that.
2 years of that physical fatigue, but I love this story, Mark, because you really touched upon the mental and emotional element. Going to therapy, being called liars, I mean, they're...
Yeah. And think of how important every single one of those people is, whether you're the person welcoming people to the hospital or an ICU nurse or the ICU medical director, every single one of those people is important.
Thank you for elevating their stories.